Today we are presenting our shoulder webinar that we titled How to Add Strength and Prevent Shoulder Injuries. I am Jenny McAteer. If you don't know me already, I recognize a few of the names of participants that are already signed in here. But I'm the owner of Resolve Physical Therapy. I opened it about 2.5 years ago. And then with pandemic, we kind of started doing these workshops and have just had a ton of fun doing them. So we've continued, and I think, gosh, this is our 5th or 6th one. So if this is your first time joining, thanks for signing up. And we've done previous ones for runners, for neck pain, lower back pain, knee pain. And I think we did another running one after that. So now, yes, we're into shoulder pain. So I am one of the physical therapists here, and I've been a PT for about 11 years now, and enjoy working on all kinds of different types of injuries, but the shoulder is a pretty fun one. So I'll be one of your presenters today. And then we have...
Hello, everyone. I'm Maddie. I'm the new kid on the block here at Resolve. I've been working here for about 6 months, I think now, and loving it. So here for another webinar on the shoulder.
All right, so the things that we're going to kind of cover today is we're going to go over some basic shoulder anatomy with Maddie. And then I'm going to go over some common kind of shoulder diagnoses that you hear of or see, or maybe you've diagnosed yourself with from Google Doctor. And then we just have a few little tips and tricks of some things that you could change right now to kind of start helping better movement patterns on kind of everyday activities. And then as usual, we're going to leave you with some exercises. And this one kind of includes stretches and some strengthening and some stabilization. And then we'll end with some ideas on how to do your own myofascial release. So foam rolling, lacrosse ball, those kinds of things. As a little side note, as when I'm speaking, feel free to type questions in the chat or the question and answer box. And whichever PT is not speaking at the time, we'll try to answer those. So feel free to speak up as time goes on. You don't have to wait till the end or anything like that. And we'll kind of answer as we go along. So we'll start you off with Maddie here.
All right, guys. Let's start with some bones. So your shoulder is made up of this humerus. That's your main arm bone. Then you have the scapula, or your shoulder blade, that kind of sits on the back of your rib cage there. Has these fun little prongs that hang out. And then you have your clavicle that comes across right here. So what you're looking at here is a ball and socket joint. Ball and socket joints are great for mobility. They allow a lot of range of motion. Not so great for stability. So we got to get that somewhere else. So basically this ball is just kind of sitting in a little shallow bowl, rolling around. So if you can think, if you go up, gravity is going to kind of want to pull that ball right on out. So to kind of compensate for that, we have something fun called a labrum, which kind of sits on the bowl, and it kind of increases the bowl depth. It gives it more surface area for the joint, so it's more congruent. And increases our stability a little bit. Another way that we try and get a little more stability with the shoulder is with our rotator cuff, which I'm sure you've all heard tons about. So the rotator cuff is made up of these top 4 muscles right here. And they're shown in the picture over here, so you kind of get a better idea of what exactly is going on in that shoulder joint. So you have the supraspinatus, which sits right on the top here, and it helps hold the head of this humerus kind of tucked into that joint, especially as we elevate, just kind of keeping it in. Infraspinatus is, oopsie, sorry about that, is this muscle right here. This is the rear view. So that's kind of sitting right on top of the back of your shoulder blade there. So that one, along with teres minor, this little guy right below it, they help to externally rotate your arm and also just to stabilize it, especially when you get overhead. Last part of the rotator cuff is your subscapularis. So that's this guy here. So it is sitting on the front side of your shoulder blade, kind of in between the rib cage and the shoulder blade. And then there it is. And it's going to help internally rotate that shoulder. So those are your 4 rotator cuff muscles. We also listed biceps here because with shoulder pain, the biceps gets involved pretty regularly. There's a little groove right here on the humerus bone where that is one of the attachment sites to the biceps, and it also kind of attaches to our joint capsule. So if anything starts to tighten down, or if we have a tear or anything, that biceps tendon can get kind of irritated. So yeah, that about covers anatomy. Let me know if you have any questions. Okay. Otherwise, we'll move on. And Jenny will take over.
Okay, so the shoulder is pretty involved, more than people think. And so when you come into physical therapy, we have to do quite a bit of differential diagnosis, as we call it, to be able to kind of tell you where your pain is coming from. So we're not going to go over all of these things, but most of them. So the one that sometimes surprises people is that shoulder pain can come from issues with your neck. So if you have a pinched nerve in your neck or a bulging disc or some instability there, that can cause pain to go down your arms. So we always like to rule out the neck as being a source of pain to begin with. Then the other most common one, which we'll go into details on some of these, is osteoarthritis, or just arthritis is the same thing. Shoulder impingement is a very common diagnosis, pretty equivalent to saying that you've got a muscle strain or you have tendonitis in your rotator cuff or your biceps. They all kind of encompass the same idea. Or you could be diagnosed with shoulder instability. So those are people who commonly have dislocations or subluxations where it doesn't quite dislocate all the way, but partially. Or you just are one of those people that has a lot of popping, clicking kind of noises. And then last but not least, of course, is rotator cuff tears. So the most common diagnosis that we see for shoulders is called a shoulder impingement. If you already know you have this, let us know, say me or something in the chat. So we kind of know if the majority of you are also dealing with this. So again, kind of synonymous with strain or tendonitis. So some of you texted us back on kind of a specific diagnosis. Some of you mentioned biceps tendonitis. And again, that will kind of fall into this same definition, cause, symptoms kind of things. So a shoulder impingement is when you get so much swelling in your shoulder that it causes kind of a reduced space right here between all those muscles and tendons in that bony area that Maddie just went over. So it kind of makes that tendon rub against your bone. And as that happens repetitively over and over and over again, it really irritates those surrounding muscles. So we tend to see this in patients who have to do a lot of overhead activity, either for work or for leisure, or if they're into overhead sports or like the baseball kind of pitchers. We see this a lot in. We see it a lot in weightlifters, so CrossFit, bodybuilders, those kinds of people who do a lot of overhead lifting of barbells and things like that. Commonly get impingement. Sports, like I said, baseball, tennis, those kinds of people. For work, if you're like a painter, constantly pushing against the wall and going up and down, you're going to get it. And then there are some people who get it from a trauma, such as falling and trying to catch yourself, and you kind of jam that bone up against those tendons, then that can also cause an impingement as well. Most of the time people come in and, you know, we ask our million questions about how bad it hurts and where it hurts. And typically for this kind of a thing, you're someone who's going to be getting a lot of pain on the front of your shoulder or kind of down the middle of your arm here. And I always say the angrier it gets, the farther down the arm it probably goes. So if it's getting way down to the elbow, you probably should definitely be in here. Pain with those overhead activities after a certain point. Pain laying down, if you're laying down on that shoulder at nighttime and it's waking you up in the middle of the night. You could be someone with impingement. If you have pain kind of reaching behind your back, that can be another sign of impingement. So it just really decreases that space. And so it just doesn't have enough room to move around, and you get kind of pinching feelings. All right.
5 people say yes.
5 people said yes. To the shoulder impingement. So yes, very probably, like I said, the most common one that we see for sure. All right, so next we have osteoarthritis, which like I said, is just arthritis too. So some people get confused when we throw the osteo in front of there. And so when she kind of showed you the ball and socket joint, you have the cartilage that's between those bones that protects your joint surfaces. And so it's when that cartilage really starts to wear down. And so then you get, you know, more bone on bone is what most people will hear, which then causes a lot of irritation and inflammation and right in that bony joint. And so this typically happens, we see it more often in like 50 and older. So again, if you think you have more pain from osteoarthritis, say me in that chat. So yeah, kind of the one where you hear wear and tear, bone on bone, those kinds of things from repetitive shoulder movements you may have done your entire life, again, for work or sports or whatever. Or sometimes it's from a previous trauma. So if you did take, you know, one bad fall or a few bad falls, sometimes later on in life is when it kind of shows back up to get you. So this one, you'll have swelling in there, so it might feel kind of tight. You'll have a lot of stiffness in that joint. Some of the like Google arthritis, and the number one thing that should show up is that you especially have issues first thing in the morning. That's kind of a cardinal symptom of arthritis versus more like a muscle strain or impingement type of a thing. Yes, there is some crossover, but just to give you an idea of maybe how to tell the difference between some of them. Or if you've held the position for a long period of time, it can be hard to come out. Now, a long period of time can be like 2 or 3 minutes. And then trying, you know, with your arm above your head, painting, we'll say again, or putting up a light bulb, and then trying to come down can be really painful. Anyone suffering from that? Get a few.
We got a couple more impingements.
A couple more impingements as you're thinking about it. Maybe you're trying some of these motions. Okay, so then we have a rotator cuff tear. So tears kind of get, when you get an MRI, they'll put it into kind of a category of small, medium, or large. So the small to medium tears quite often can go without surgery. Because I think someone had texted us that they were trying to recover from a rotator cuff tear, a small one. And you can. A lot of people do just fine recovering from a small to medium tear without having surgery. Now, a large tear or full thickness tear is the other terminology that's often used, is when that tendon that attaches your muscle to the bone completely separates from the bone. So full thickness tear there. So again, this one is kind of all ages. So because it can happen traumatically or kind of atraumatically. So some people, if it happens traumatically in Bend, we often see it from people falling off their mountain bikes, falling down skiing. We see rotator cuff tears from trying to lower something heavy typically, and they drop it. Or again, we can just see it in our 50 and older crowd who just over time has slowly nicked away at that tendon until it was gone. So the symptoms often seen with this one or that you're unable to lift your arm up over shoulder level, or especially out to the side, starts to become really painful. Often people will talk about having the worst pain at nighttime. Sometimes they're not so bad during the day, but nighttime definitely worse. And when you start having pain when you're not even using it, probably a sign that you have small to medium tear in there. And then it progressively gets weaker. So it gets harder and harder to lift that arm, or comb your hair or put on a shirt. Those kinds of things just get harder and harder for you. One little caveat to this is for the full thickness tears, sometimes you get that full tear, which makes it so you actually don't have any pain signals. And so sometimes somebody will come in and they can't lift up their arm, but they don't talk about having pain. And it typically ends up being kind of they don't have pain during the day or with activity, and it ends up being they have that full thickness tear, and they will talk about pain at nighttime. So and occasionally I'll also get like a super strong guy in here, sometimes gal, that has really strong deltoids. And so they're just able to compensate really well with other muscles. And again, kind of the red flag is that the pain kind of persists, especially at nighttime. So I know, again, like we said, that we had one person that said they had a tear, but has anybody gone through having a rotator cuff tear repair that's listening tonight? Or do you think you currently have a rotator cuff tear? Again, kind of let us know in that chat box. Okay, so last but not least, this is one of my favorite ones to work on, is instability. So this is the people who dislocate a lot, again, or sublux a lot, or they're just someone who comes in and tells us that they're double jointed is a common way to put it. So this is typically our younger than 40 years old or so age, quite often even starting into being high school, college age is where we probably see it the most often. So it's when the structures in your shoulder joint just aren't working well, either because they're weak, because they're stretched, because they were born with them being lax, that just can't keep that ball in the socket. So again, these are people who come in, talk about it popping and clicking a lot, not necessarily painfully so, but popping and clicking a lot. And then when we look at them, like this picture shows, with their shirt off, and we have them kind of lift their arms up and down, we'll see what we call scapular winging or shoulder blade winging. So you can see this guy's shoulder blade, especially on the right side, just poking out here at the bottom. And so when we see that, those are also the people who kind of just feel like they don't have smooth movement. So especially as they move into overhead, they'll feel that it's not smooth, that it's kind of rubbing on their rib cage. It kind of gets stuck, things like that. And that's just because those shoulder blades just can't move the right way. They just have no stability whatsoever. So kind of like Maddie said, the shoulder is complex because it's the most mobile, one of the most mobile joints we have in our body, which just makes it that much easier to be unstable. And so yeah, people will have weakness, a ton of weakness in the shoulder or even in the postural muscles. This happens traumatically sometimes. Sometimes you can have such a bad tackle in football or a bad fall that you can actually hurt a nerve that will cause this to happen. But most of the time it's just somebody who's just undertrained and then doing too much repetitive motion that ends up coming in with issues for this one. It happens in more females than males as time goes on, but we see it in both. So some people, I don't know if you've heard of this, but some people will come in, like I said, with saying they're double jointed, or Ehlers-Danlos syndrome, EDS, is another common diagnosis that will come in with all this instability. So it's like those people who can pop all their fingers or bend their wrists back too far, their elbows go the wrong way when they straighten them out. Sometimes they're going to be more vulnerable to having some instability in that shoulder. And Otherwise, we'll see people who just maybe haven't rehabbed very well from a previous shoulder injury. And so the pain persists. So then weakness continues to get worse. And then things just become really unstable. Okay, I'm going to pass it back to Maddie so she can go over some things that you can start kind of thinking about right now on what to fix.
Someone just sent a message. Perfect timing. Alrighty. So first trick here is to have proper form. A lot of times when our scapular stabilizers, like our rhomboids or our lower traps that kind of hold that scapula steady to our spine and to our trunk to allow a nice stable base for the shoulder to move on, when we're kind of lacking in that, a lot of people get this upper trap that just turns on and we end up shrugging a lot, especially as we get higher up to overhead activity. So try and be conscious of that. Think about pulling your shoulder blades down and back, kind of engaging those smaller postural muscles. Also, when we're looking to strengthen our shoulders, we don't want to do too much too quickly. So we looked at the rotator cuff muscles, and what do you guys think? They weren't too big, were they? They were little guys. So we don't want to just put a whole bunch of weight really far away from them and make them work super hard. That's a good way to irritate them pretty quickly or cause an injury if they fail at whatever task we're asking them to do. You want to be able to do exercises slow and controlled. If we can't do things slow and controlled, then we're probably bumping our weight up a little too much, too quickly. And then we also want to stick in a pain-free range. So if we're doing like a weighted, I don't know, like a Y or something, and it really hurts at the very, very top, don't press into that pain. Just stick a little bit lower and control it back down. Pain is there for a reason. It's a great thing that we have to help warn off injuries. If we're ignoring that kind of pain and just kind of pushing through it, usually we're leading down the road to a worse injury. It's always great to warm up before we exercise, especially as we age. Our tissue kind of loses extensibility. We kind of need to get those muscles and tendons primed for what we're asking them to do. Usually, really light movements, just getting them kind of warm and ready to work. We don't just want to hop out of bed and start doing push-ups or chin-ups or something like that. Another little tip is sleeping posture. So some people think it's really comfortable to like sleep with their arm overhead, which can kind of stretch out some parts of the joint capsule and tighten down others, and you have a whole mess of nerves that run under your armpit that can be getting stretched and irritated, and we get numbness and tingling and all that fun jazz. So usually it's just better to keep that arm kind of below this 90-degree while we sleep. Last tip and trick, our favorite thing. Everyone comes in saying no pain, no gain, and that is just not the case. Like I said earlier, pain is a wonderful thing most of the time. If it sticks around too long, it gets annoying, but most of the time it is telling us something like, we can't handle this. This is too far of a range. We need to back down a little bit. So if things are hurting, you should probably just stop. If it's something you love, probably come in and see if it's something that is going to be damaging to your joint or your tissue, or if there's a way to modify so that you can keep doing the things that you like. But yeah, no pain, no gain is a myth, and we're here to bust it. Okay, so Bend is huge on paddle sports, whether you guys are subboarding up the Deschutes, or kayaking, or rafting, or rock climbing. We want to kind of keep those shoulders below 90. So that guy in the first picture there, he's got his shoulder way up here. We're kind of disadvantaging all those rotator cuff muscles we just talked about. And then when we get up here, we're probably just trying to use all arms. So this guy over here in the orange, he's got a nice little squat going on. He's using his whole body. Especially for supporting, you can hinge at your hips and use your core and lean and pull, which is what you're going to want to do when you're kayaking or rafting or anything like that. All of the force should not be through that shoulder joint. You're asking it to do a lot to propel your whole body against water, and then you don't want to put it up here in an elevated position. So I was always told, I was learning to kayak, to keep my shoulders in my box here. You don't want to get way out here. You just want to rotate like that. Same thing with paddling and rafting. You want to keep those shoulders down. It's going to put a lot less stress through the joint. Okay, so on to some more exercises. We're going to start with stretches. So this is a doorway stretch. It's to stretch out your pec muscles. So you have two big muscles on your chest, pec major, pec minor. So you want to put your arms on a doorway, kind of stride stance your feet, and you can just kind of control how much weight you're leaning into that. You should feel a deep stretch across your chest. It shouldn't be sharp or shooting. With this one, you can kind of play around with the angle of your elbows and your arms, because it's going to hit different fibers of that muscle. So it's a big fan muscle that kind of attaches over here and then spreads out. So different angles will hit different fibers. So excuse me, you can play around and see what works best for you. Stretches are best done a couple times a day, and for at least 30 seconds. So our body is really good at just tolerating being in a position, especially if we don't hold it there longer than 30 seconds. We won't actually see any tissue elongation. So if we're hanging out for like 15 seconds, it might be uncomfortable. We might feel a stretch, but nothing will probably change. Okay, next stretch is an opener. Looks like you're opening a book almost. So you can start in half kneeling. We like to do it against a wall, so you feel a little more stable, and you're kind of in the right posture and position here. So you should feel a stretch in your shoulder, and you might also feel a stretch in your thoracic spine, or kind of that mid-back in between your shoulder blades. Same thing, we don't want to be sharp shooting or pushing into ranges of motion that are painful. Okay, last stretch here. You get to look at my goofy grin. This is a thread the needle here. So it's more of a dynamic stretch. It's more moving. So you'll be in a little tabletop position. You'll rotate up and then kind of thread your hand through your arm. And same thing, you should feel a stretch in your shoulder joint, or maybe your thoracic spine, just kind of getting all of that tissue, kind of shoulders and in between, stretched out. You can hold a few seconds. Usually good to just rotate through that position a little bit. Like if you're doing yoga, or if any of you people like to do yoga, like a cat cow, you just kind of rotate through and feel a nice stretch. All right, here is some strengthening exercises, and I think Jenny's gonna take over.
My friend Ashley liked the thread the needle name.
All right.
Okay, so these are pretty basic strengthening exercises. It gets hard to get into with actually doing an examination on a patient. So of course, consulting with us in person would be much better. But These basic ones are a good baseline to start with. If you can't do these, then you really need to be seen. So everybody should be able to at least go through these without too much of an issue. So first one we'll usually give people is rows. And so it's where you stand with a TheraBand is the easiest way to start it at home anyhow. And you pull your elbows back. And so the biggest issues we see with this one is some people just move their arms, but they don't actually engage their shoulder blades whatsoever. So even as basic as it seems, it's a good starting point to make sure that people are actually using their shoulder blades when doing rows to get those scapular muscles, rotator cuff muscles actually going. So we always give kind of the cue of squeeze your shoulder blades down and back. And again, because like Maddie said, some people will shrug, some people only move their arms and not their shoulder blades. And then sometimes they'll let their back arch and let their bellies kind of push out as they're pulling back. So that's why we put braced abdominals. You should have good tall posture, looking straight ahead, and be holding that core in always. We usually like to start with, 2 to 3 sets of 15 before we increase weight. So if people can do 2 to 3 sets of whatever weight they're doing, then it's then a good time to kind of bump up from there. The other one that we like to start off with is external rotation, we call it. So it's a pretty isolated rotator cuff exercise. So when you're in the gym or doing classes, things like that, you're doing much more global strengthening where you get to use multiple muscles at one time. So very rarely do you actually just strengthen this muscle by itself on its own, except for when you're doing this. So this one is harder than people think that it is. So again, kind of a good baseline to kind of see where you're at. All you need is a little tiny piece of TheraBand. So, and for those of you who don't know, different colors means different resistance. So green is usually kind of middle ground, depending on the brand you buy. So we usually start with kind of green or blue for most people. Key is to keep your elbows in at your side. Most people end up letting their elbows want to pull away from their side, and then you get to cheat and use other muscles if you do that. So keep your elbows in, and then you want to keep your wrists straight. So sometimes if it starts to get too heavy for people, they'll kind of cock their wrist back as they're rotating out. So you want to keep those wrists straight so you don't have to come back in for a second issue there. And again, stand tall, engage those shoulder blades as you're rotating out. You can do both shoulders at once. You can do one at a time, whichever. And again, the 2 to 3 sets of 15, if you can do that, it's time to bump up to a stronger band or to kind of what we would call phase 2, rotator cuff strengthening. Number 3, I like to call them A's, as if you're making kind of the letter A, but also kind of known as shoulder extension. The key here is to face your palms forward. So a lot of people will do this exercise with a cable machine, with TheraBands, whatever it may be, but with their palms turned the other way. And that just, to me, is just not a great position. It rolls our shoulders forward. And I think we do enough activities with our shoulders kind of rounded. So it helps open up the posture, open up the shoulder joint, and train those muscles that are usually undertrained. So it's a lot harder with palms forward, and then you have to keep your arms straight. So some people try to bend their elbows as they kind of go forward and back with this one to help, so let their triceps help them a little bit more than they should. So to get the shoulder strengthening that we're going for, you want to do palms forward, don't bend your elbows, keep them straight. And then it's just pulling your arms straight back. And again, you should feel your shoulder blades engage. One of my favorites to give somebody, just because it's, again, another one that's way harder than it looks. And we're trying to give you ones that you can do at home, just in case you don't go to the gym or whatnot. So we call these wall slides. So you just get a piece of TheraBand, you tie it in a loop, stick it around your wrists, like you can see me in the picture there. And then it's just sliding your arms up the wall. So you'll be surprised as soon as you kind of pull your arms against the TheraBand resistance, how much it automatically engages your shoulder blades right away. And so then you're just kind of sliding up, again, slow and controlled, like Maddie said, and sliding back down. And again, way harder than it looks. So don't knock it until you try it. Key here is keeping the wrists over the elbows. So because it is hard, the fists end up coming close together instead of staying out over your elbows. So that will help keep proper shoulder blade engagement. If you kind of focus on that as your good movement patterns there. Okay, there's a ton of stability exercises that we can give for the shoulder. We're just going to throw one out here for tonight, kind of for sake of time. And again, it kind of is better if we can get a good examination on you to see which stability exercises would be best. But a good starting point is called ball on the wall. I always tease that there's probably like some kind of therapeutic group somewhere that for ball on the wall, because everybody hates this one, but it's a good one. They probably hate it for a good reason in a PT mind of something we can actually work on. But yeah, nobody likes this one. But it's just taking a ball. You can use any kind of ball. So we usually use a Pilates ball when we're here in the clinic, or even a big exercise ball. Some people at home will use their kids' basketball or volleyball, and that works just the same. So just like the picture shows, you just kind of grip the ball, push it up against the wall. Shoulder should be back, not falling forward. So set that shoulder back, and then you just do circles. So we try to shoot for 2 minutes. So again, that might not sound very long, but 2 minutes doing that is it will definitely work. Yeah, especially if you're in that instability category, or just someone who's got so much weakness in the shoulder at this point. Because people get a little bit bored, they'll do circles both directions. Sometimes they'll draw pictures with their ball, whatever it may be, to try to keep you busy for 2 minutes. And always do both sides is another thing. We get some people who get so set on doing just their injured side or painful side, but I'd encourage you to do both. One, it's always kind of a good comparison because symmetry is good. So if both can do it pretty equally, then that's a good sign that you're kind of moving along and doing better, as well as it's just a good one to keep your shoulders healthy. So always do both sides. Again, shoot for about 2 minutes. Are we doing good so far? Any questions or anything? Okay.
We're doing good.
Okay. Myofascial release. I'm going to turn that back over to Maddie.
Alrighty. I feel like most people I talk to in Bend have a foam roller. Seems to be a way of life out here. So foam rolling is really good for big, broad muscles. If you think about how much surface area is on that, it's usually better for like big muscles, like this lady over here is kind of rolling out her lats. And this gal over here is like those big muscles that kind of run along the spine that get a little tender. So it's good for those big guys. Maybe won't hit quite so much as the little stabilizing muscles that we talked about with our shoulder, but also very beneficial. Also, you can see this guy in the blue shirt over here. He is doing another pec stretch. So laying on the foam roller with it along your spine kind of just keeps that spine super straight, and kind of opens our chest up this way. So most of us, unfortunately, are on computers or phones all the time. So we're kind of slouched over, not because we mean to, but just because our mind gets lost in something else. And that's kind of easy on our muscles, and kind of a bad habit to get into. So those pecs can kind of tighten down, pull our shoulders forward. So if you feel like you have that kind of posture, try and just laying on a foam roller, arms out wide. That feels really nice. Usually it's not a posture that we're typically in, and it feels nice to kind of open back up a little bit. We also have YouTube videos. I think we have a foam roller one, right, Jenny?
Yes, ma'am.
Yes, we have a foam roller one for some extra pro tips if you're looking for them. But yeah, great for broad muscles and doing a little stretching You can also lay your full body weight on it, which can be a little tender and uncomfortable. Um, so we also have a lacrosse ball video. So lacrosse balls are great. Um, for those of you who've never played lacrosse or don't know what a lacrosse ball is, um, it's, I don't know, about the size of a tennis ball. And it's like dense rubber. So it doesn't have much give to it. It's pretty firm. Um, so it's smaller and it's going to feel a lot more acute. Um, so it kind of can get into like littler grooves and tender spots or those trigger points and stuff like that. So you can lean up against a wall with them and kind of choose your own pressure. Like however hard you lean into the wall is how hard the pressure on the ball is going to feel. This gal here, she's really leaning in and adding a little extra overpressure with her hand. And then this lady over here is just laying on it, so full body weight. So you kind of get to choose however much force you want. Start light. It shouldn't be painful. It can be uncomfortable. That's okay. But if you're getting like really sharp pain, probably ease up a little bit. If you're getting nerve symptoms like numbness, tingling, or like shooting down the arm, you're probably kind of rubbing around on a nerve. So maybe ease up on that as well. Switch a different position. That's not gonna ease your pain usually. Um, so yeah, we also have YouTube video here with Jen kind of walking you through some common things. In this picture, she's rolling out those rhomboids and those paraspinals that help hold the scapula stable. And this lady here is kind of on the anterior, getting a little bit of pec and some of that bicep insertion there. But really good for smaller points that you're having trouble hitting with a foam roller. Okay. We wanted to touch on these two things because they're pretty popular these days. So
Who has one?
yeah, who has a Theragun or a Theracane? Theracane is just a rod with little knobs and balls on there that you can kind of hook around you, or I don't know. There's all kinds of ways. I think it comes with a pamphlet with how to use it. um, but it's pretty good for trigger point release. So a trigger point is like those little spots that you find that are tender, but it's not just where you press. It kind of like radiates around. So really commonly, it's like in the back if you have a tender spot and you kind of feel that like ram's horn kind of up your head, or you get like headaches like up here, but then you have really tense shoulders and stuff. So they can be good for trigger point release, and usually they respond pretty well to just sustained pressure. So just finding them and holding on and kind of just breathing and letting the little point kind of melt away to where you're not feeling that radiating pain anymore. Theraguns are like the new it product, guys.
We got one that admitted to a Theragun, but no Theragun admitters yet.
Oh, no Theragun admitters. Well, I bet one of you has one. It's basically just simulating some soft tissue, or kind of like what we call tupotment, which is a fancy word for just like basically repetitively tapping with a little bit more force. Usually feels pretty nice. All soft tissue work is gonna increase blood flow to that area. You might have a little bit of redness. That's okay. That's normal. That's blood rushing to the area. You're kind of getting more nutrients to those spots that kind of need it. You don't want just kind of fluid hanging out. Things are always tense and tight, and then they get kind of knotted. So soft tissue work or myofascial release is really great, and usually it can be uncomfortable during, but then afterward you're feeling looser, you're feeling like a new person. So it's really nice to try. You don't need to do it for like 3 hours.
Right.
It's not necessary. Try it for like 5 to 10 minutes. See how you feel. You don't want to just beat up on yourself for like an hour. You're probably not going to feel better after that. But soft tissue is a great thing, and we usually incorporate it into our treatment at some point. Pretty much with everyone. Feels nice and it helps. So okie dokie, back to Jenny here.
All right. We are wrapping it up. So it looks like most everybody hung around with us. So thank you. It's a lot to go over in just like 45 minutes or so, but we try to be thorough and to the point a little bit. So again, if this is your first one, thanks for joining us, and keep your eye out for future ones. And if you are someone who comes to all of them, thank you. We appreciate your continued support. So kind of for coming today, we usually do an offer at the end of our webinars. So we are offering kind of the shoulder examination for those of you who have not had physical therapy before. We kind of wanted to go over what that actually means, at least when you get one at Resolve. So we go and do a strength test. So all those muscles we talked about, we go through and test each one of them kind of individually and tell you which ones need the most work. We go through and check your mobility. So some people are really tight. So especially with all that we do, we have, again, those tight pecs. So we'll kind of do a mobility check on where your pecs are, where some of your other muscle mobility is. A lot of the CrossFit people have to be able to get, those bars back behind them and just don't have the shoulder mobility. So we'll kind of check that and tell you where you are with those things. And then we'll do our poking and prodding, as I call it, where we'll kind of check your soft tissues. So if you have some big trigger points, we'll find those. If we poke around on the pecs, and we can kind of tell you where your tight spots are on those. Most everybody has some up through their neck after having shoulder pain for a while. So we'll check through those. And then we'll give you a diagnosis. So we get so many people that come in here and have maybe even seen their primary doctor, but not quite a specialist yet. And they still just have no idea what's going on. They've tried to Google doctor themselves. Doctors maybe said you have shoulder pain, but that hasn't really told you what it's from. So the most patients I get that are most surprised by the fact that we go through what we call special testing or differential diagnosis. So we go through all these different tests to give you an idea of exactly what's going on. Is it impingement? Do you have a tear? Is it instability? We'll tell you what's going on. So hard to do that over, webinar. So again, coming in, take 1 hour with us and we can give you all this information. And then we always end, of course, with a bit more of a personalized exercise prescription. So if the things we just showed are the appropriate thing, great. But if we find some other things, if you're past that phase and we need to give you something else, or even those things are too hard, there are steps to go back before that, if that even hurts, or if there's just specific goals you want to work on. Like a few of you keep mentioning push-ups, like come in here and show us your push-up, and we'll tell you if it's more of a mechanics thing, a weakness thing, a mobility thing, those kinds of things. So PT, I think, is a lot more than just giving you some strength exercises. And so we'd really love to do a full shoulder examination on you. I put to check out our Google reviews here. If you're not familiar, with the Resolve gals here, we do one-on-one treatment. So we don't have aids or anything like that. You're with a PT for a full hour each time you come here. So you're just going to get a lot more bang for your buck and probably save you money in the long run, because you usually end up coming less. So get on, check out those Google reviews. Most of them will comment on the fact that you get one-on-one and kind of a quiet personal PT space. So shoulder examination, we're going to give it to you for $100 cash. In that examination, we'll do all the things that I mentioned on the previous slide, as well as we're going to give you your own lacrosse ball, your own exercise band, and then again, your own personalized we'll give you pictures with descriptions, repetitions, sets, how often to do it, all of those things all laid out in a nice format for you. for $100, or we take insurance. So all major insurances, there's a few that we're not in network with, one being Moda, and Providence and Aetna are kind of the three main ones that we're not in network with. That $100 is still pretty good deal there. So we can bill insurance. We're happy to. Some insurances need a doctor referral, but mostly for Oregon, we're a direct access state. So main ones that will require one are like Medicare, or Medicaid. So most of you can come directly to us without having to worry about going to that middleman. So feel free to call us and we'll let you know exactly what it covers or what it might cost for you otherwise. Otherwise, the $100 cash offers is for you. So we want you to book your appointment in the next 7 days so we can get you on our schedule. Now, this doesn't mean you have to be seen in the next 7 days. Just call us in the next week. Again, also, so this doesn't just drag out forever. We want you to call the next 7 days to make your appointment, hopefully in the next month or so. There were a lot of you that texted with pretty specific pain and injuries that you were having. So definitely could benefit from a 1-hour appointment with us to just get a little bit better personal examination and evaluation and exercise prescription, as well as get your own little lacrosse ball and band so you can go to work on all this stuff that we just showed you. So our phone number is right here. Our website is right here, resolveptbend.com. On the website, you can click request an appointment. So even if you don't want to call us, you can send us an email through the website, or you can email us directly through the resolveptbend@gmail.com as well. So any of those ways work just fine for us. So please do it as soon as possible so we can get you booked and get you on there and get you the deal that we're offering for you for joining us tonight. And thank you. Thanks for coming. Thanks for listening to us jabber off here for almost an hour. Hopefully it was good information. I know it can be a bit overwhelming, so I'll let you know now that tomorrow we will send out the replay. So you can watch it all again. So you can have all that information to watch over and over again till you feel like you understand it maybe a little bit better. We do have a Facebook and Instagram that we are quite active on. So it's at ResolvePTBend. Check it out, follow us. And we do have a YouTube channel. So if you just search for Resolve Physical Therapy on there, it should bring us right up. So we have different videos on there, from stretches and strengthening to tips on running, the foam rolling, all kinds of stuff that way. So check us out. And if any questions do pop up, feel free to reach out to us and we'll answer best we can. But hopefully we'll get to meet some of you here face to face in the clinic. All right. Are you in the middle of typing? I don't want to interrupt a question. Okay. All right. Thanks, everybody.